Hi, welcome to First Aid and Common Ailments of the Horse Part 2. Last week we talked about what makes up the healthy horse and how to assess your horse and get an idea of what his or her normal appearance is. This week we're going to look at some of the conditions and scenarios that can cause illness or injury in your horse and what some of the symptoms of those conditions are and what you can do about them. First of all, let's look at a sensible first aid kit or medicine cabinet. As you can see, we've got some gloves, we've got some Hibi scrub for cleaning, we've got some alu spray, which is that spray on the right hand side. That's useful for putting over minor wounds and abrasions. It's creates a sort of a covering over the wound, which is useful for keeping flies off, particularly in the summer. Behind that, some swabs which can be used for cleaning, some cotton wool, animal intex, poultice material, and then a couple of different types of dressing on the left hand side, some rhinofoam, which is a type of absorbent dressing, some melalin, which is a sort of a non-stick dressing, and then in the middle we've got a range of different sort of bandage materials which will help to create your layered bandage. We've obviously got some duct tape, which is fantastic for holding poultices on feet. Can also be used in a pinch to hold your bandage together. And also down at the bottom there we've got a digital thermometer and a large syringe which can be useful for administering medication. I think it's important to note when you're cleaning a wound, you really don't need very much Hibi scrub at all. So in a sort of a 5 litres of water, you really just want to pop a sort of a dash of Hibi scrub in there. Any more than that and you run the risk of actually damaging the cells which will be endeavouring to repair the wound. The only thing that's not pictured in this photo, which I think is probably sensible to have in your yard, is a small supply of equipalazone or bute or Danilon or some other equivalent non-steroidal anti-inflammatory drug. That can be useful in the scenario where you've got a horse with a minor knock or a sort of a bruised foot, for example, where we may want to, after discussion with us, some advice over the phone, we may want to suggest that you administer a low dose of bute for 3 or 4 days to see whether that solves the problem, and in many cases that may be sufficient. That can help you avoid the the cost of a full call out in those situations which don't require it. In many cases, such as in the scenarios we can see on the photos on the slide, it's going to be abundantly and immediately obvious that your horse needs a visit from the vet. However, in many cases it's not so cut and dried or black and white. So now I'm going to try and run through a few common conditions, common emergencies, to help you become familiar with some of the symptoms and help you become aware of when a veterinary visit may be required. This is a list of some of the more severe emergencies that you and your horse may be unfortunate enough to come across. It's not a complete or an exhaustive list by any stretch, but hopefully it gives you an indication of some of the more serious conditions and certainly ones that would require prompt veterinary intervention. Fractured limb. Many limb fractures are able to be dealt with, stabilised and repaired given the sort of the advances in modern veterinary medicine. However, in the first instance, we would like to see these as soon as possible so that we can assess the injury in situ and then guide you as the best way forwards as regards sort of further treatment, stabilisation, referral if necessary, etc., etc. Non-weight bearing lamenesses. The commonest non-weight bearing lameness which you'll come across will be a foot abscess. However, it's very difficult sometimes to distinguish between a foot abscess and something more serious. Foot abscesses are particularly painful for the horse, and it's not a condition we want to see them in for any longer than necessary. So again, that's something that we would really like to see as soon as possible as well. Many of us may have horses that like 40 winks and that might not always jump to their feet as soon as we appear at the stable door. However, all horses should be prepared to get up given adequate stimulation. So if you've got a horse that is recumbent and won't get up, then that certainly does warrant some further investigation. And there can be many different causes for that scenario. Yeah, certainly that was one that we would like to investigate, sooner rather than later. Wounds requiring stitching. We will talk about wounds in more detail slightly later on in the talk, but there are many advantages to seeing a wound sooner rather than later. So again, that's certainly something to get on the phone to us. If you think you've got a wound that is deep enough to require stitching or that may have injured an underlying structure. Colic. Obviously colic can range from the mild to the severe. Even if you've got a mild colic, it's certainly worth giving us a ring and letting us know that there's something going on so that we can be prepared to respond and attend should it get more serious. Eyes are particularly sensitive to injury or damage. Sometimes if it's a sort of an eye that's undergone an injury and it's damaged, it's punctured, then that is abundantly clear that needs to be seen as soon as possible. In other cases, the eye may just be closed or maybe sort of leaking, maybe tear stained. This can be indicative of an ulcer or some other sort of cause of inflammation. But eyes are particularly sensitive. They can go downhill very quickly. So again, that's definitely something we would like to see as soon as we can. And finally, continuous bleeding. Obviously, the best guide to how serious something that's bleeding is the amount of blood that's coming out. So does it look like a tap that's dripping, or does it look like a tap that's turned on? If it's the latter, then obviously we really do need to see that as soon as possible. And whilst you're waiting for us to come, then we really need to put some pressure onto the source of that bleeding. But again, we will talk about this in slightly more detail later on in the talk. So the first topic I'd like to look at in more detail is colic. Colic is generally a catch-all term that refers to abdominal pain. Obviously, in the vast majority of cases, this abdominal pain is caused by a problem related to the gastrointestinal tract. But it can be caused by any structure within the horse's abdomen, so which includes the reproductive tract, the urinary tract, and the other abdominal organs, and the peritoneum, which is the structure that lines the abdomen. The signs of colic are sort of shown by this diagram on the right-hand side. So you've got it can range from sort of mild to moderate to severe, and you'll see these signs to greater or lesser extents depending on the severity of the colic. So it may show as pawing at the ground, it may show as the horse turning around and looking at its abdomen, the horse may be kicking at its abdomen, it may be sweating, it may be stretching, adopting the stance that a gelding would adopt to urinate. It may be inappetent, and the horse may be rolling, or maybe just be getting up and down a lot, or may even just be recumbent. You'll also often come across an elevated pulse. Anything over 60 beats per minute is certainly indicative of sort of increased levels of pain and possibly problems within the cardiovascular system. And it's also worth looking at your horse's mouth, looking at the colour of their gums, their capillary refill time, which we talked about last week, and seeing whether that is normal or delayed. So what can you do if you think your horse has got colic? Well, first of all, I think it's worth assessing your horse, so taking its pulse, looking at its gums and checking capillary refill time, and also listening to your horse's gut sounds. Do they sound reduced, the same, or increased compared to normal? These are all useful pieces of information that you can give your vet, either on the phone when discussing it with them, or when they come out to see the horse. And obviously, if they do come out to see the horse, then they will repeat that examination. Otherwise, walking colics can be helpful. Walking can assist movement of gas through the gut, and can also, if it's more severe and your horse is attempting to roll, it can prevent your horse from rolling and thus prevent your horse from potentially injuring itself. Also sometimes beneficial can be lunging your horse. This, if there's particularly a suspicion of sort of trapped gas, then a little bit of trotting, cantering, and sort of trot to canter transitions can help encourage movement of gas through the gastrointestinal tract. I think the main point we want to iterate here is that you shouldn't do any of these walking or trotting or cantering to the point of exhaustion. These are just techniques to try and keep your horse comfortable, but not to exhaust them and put them into a worse state. And if in doubt, call your vet straight away. The next disease I'd like to talk to you about is strangles. Strangles is a bacterial infection that predominantly affects the respiratory tract. It causes, as you can see from this photo, a profuse nasal discharge. It's sort of thick, creamy, white, yellow. It's often associated with a cough. There's a high temperature above 38.5 degrees, often as high as 40 degrees or higher. And there's normally the development of abscesses beneath the jaw, associated closely with where you would feel for a facial pulse on your horse's face, and also behind the jaw. These are lymph nodes that swell up and become abscesses. You can normally feel the lymph nodes beneath the jaw. There's 2 of them, and they're often about the size of a small grape. But when they become swollen and abscessated, they can swell up to become the size of a golf ball or larger. And the most important thing to remember about strangles is that it is highly contagious. What should you do if you think your horse may have strangles? I'm sure you're all familiar with the current situation involving coronavirus, and there are some similarities between coronavirus and how it's spread and strangles. So we can apply some of the same lessons. The first thing to do if you think your horse has got strangles is to isolate it. So that means it should be confined to its stable or to its own field. This is very important because there is an incubation period of typically between 3 and 14 days involved with strangles. And this means that it can take up to between 3 and 14 days for a horse that has come into contact with strangles to start showing the clinical signs of strangles. So, cough, snotty nose, high temperature. However, during this incubation period, it is possible for horses to be shedding the bacteria, so that is spreading the disease. So that means that it's really important when you have identified that your horse may have a case of strangles or another potentially infectious disease, that we are really strict and vigilant about isolation of the horse. So the easiest way for the bacteria to spread is by direct contact between 2 different horses, so nose-to-nose contact over a fence or a stable door, but it can also spread from horse to pieces of equipment onto another horse, or from a horse to a person to another horse. So that means that you can't have any movement on or off the yard, including hacking. There should be no sharing of equipment between horses. So each individual horse should have its own, that's infected with strangles, should have its own grooming equipment. There should be its own sort of wheelbarrow and mucking out kit so that you don't inadvertently spread it from one stable to another. And if you are dealing with more than one horse, then you should endeavour to deal with the horse with strangles last, after you've dealt with your healthy horses, and make sure that you change your clothes and wash your hands between horses. It's also a really good idea to have a a sort of foot dip of disinfectant outside your stable. This will serve as a place to disinfect sort of shoes and things like that, but also as a sort of a visual reminder that that you shouldn't be going from this horse to another horse without disinfecting yourself, changing clothes, washing your hands, etc. And if possible, after you've dealt with that horse, you really should go home and change, wash hands. So your vet can come out to perform various different tests to confirm whether or not your horse has got strangles. That would involve taking possibly of a blood sample or something called a nasopharyngeal swab, which is a long swab that's passed up the horse's nose into the back of the throat. And the other frustrating thing to do with strangles is that horses can outwardly recover from strangles, but they can still continue to carry the bacteria and intermittently shed it at a later date. So it's often very important to perform further tests after the disease has visibly ended to try and confirm whether or not your horse is a carrier or not, and that will try to reduce or eliminate the chances of reoccurrence of disease in other horses that your horse may mix with subsequently. Next disease I'd like to talk to you about is Laminitis. This is an intensely painful disease that affects your horse's feet, predominantly the front feet, and specifically it is inflammation of the connection between the pedal bone and the hoof wall, otherwise known as the lamini. The clinical signs you see with Laminitis are increased heat in the foot, an increased digital pulse at the level of the fetlock, and the adoption of this characteristic sort of backwards leaning stance where the affected horse is attempting to shift as much weight as possible off its front feet and onto its hind feet. You will often see in cases of Laminitis rotation of the pedal bone or sinking or foundering of the pedal bone, and I'll show you some images of this in the next slide. The risk factors associated with Laminitis, obesity, so overweight horses or ponies are significantly higher, significantly more likely to suffer from Laminitis. There is often an underlying metabolic or hormonal disease, typically Cushing's in slightly older horses, sort of 14 or 15 years onwards, or equine metabolic syndrome, which can typically affect those horses that are, or ponies that are more overweight, and that can occur younger. It can also be secondary to diseases that cause kind of systemic inflammation, such as colic or retained fetal membranes in a mare. So in this image, we've got a sort of a cutaway view of the horse's foot, and you can see at the front of the foot is the hoof wall, labelled with the letter A. In the middle of the foot is the pedal bone, which is labelled with the letter C, and between those two structures is the pink line, which is the lamini, which is labelled B, and that is the area that is specifically affected. Now, what causes rotation to occur is that the structure in white at the back of the foot, labelled with the letters N and O, this is the deep flexor tendon. This runs down the back of the leg and it inserts onto the bottom of the pedal bone. And what can happen is that as this deep flexor tendon exerts a pull on the pedal bone all the time, it pulls it sort of backwards and downwards. And in the normal course of events, this pull is resisted and counteracted by the attachment of the pedal bone to the hoof wall. But when a horse gets Laminitis, that connection between the pedal bone and the hoof wall is weakened, and as a result the pedal bone may be pulled sort of backwards and downwards by the force exerted on it of the deep flexor tendon. So in this slide we can see two x-rays of a horse's foot. On the left you have a relatively normal foot, with a normally positioned pedal bone. There's good sole depth, and yeah, the pedal bone is normally positioned. In the X-ray on the right hand side, the pedal bone has rotated backwards and downwards, and you can see that there is significantly less sole between the tip of the pedal bone and the bottom of the hoof, as sort of shown by the position of the shoe. And this means that the sole in that position will now be being pinched between the pressure of the pedal bone pushing down and the force that's pushing upwards from the ground, and this that can lead to pain, bruising, abscesses, and in the worst case scenario, actually the protrusion of the pedal bone out through the bottom of the foot, which is obviously an extremely severe and in almost all cases fatal outcome. So it's really important to correctly manage your horses and ponies to try and reduce the chances of this disease occurring. So if you think your horse may have laminitis, what should you do? This is definitely one of those cases where you need to get on the phone to us as quickly as you can, because we really need to come out and try and address the situation as soon as possible. But what you can do whilst you're waiting for a vet to come out and see a laminitic is, again, confine your horse to the stable. Ideally, you want the horse to be in a stable on a deep bed, preferably shavings, because that shavings will pack up into the sole of the horse's foot and actually sort of transmit some of the load directly through the sole of the foot, and that reduces some of the load that passes through the hoof wall. So you want them on a deep bed, and you want to make sure that bed comes right up to the door, so that if your horse or pony stands just inside the doorway with its head over the stable door, it's still standing on a comfortable bed. So you just have to manage the small amount of bedding that will fall out when you open the door. This is definitely one of those diseases where prevention is better than cure. Laminitis, if you keep your horse at a sensible weight, is eminently preventable. So I don't think it's definitely one of the diseases where you can keep a close eye on your horse's or your pony's weight. You can do that by either weighing them if you've got the facility to get them to a weighbridge, or simply by using a sort of a measuring tape around their girth. It doesn't matter so much necessarily what their weight is, as long as you are comfortable that it is the correct weight for your horse and pony, and your vet can advise you on what the correct weight would be. But by measuring them, on a monthly or fortnightly basis, you can keep track as to whether they are increasing, decreasing, or staying the same in weight. And also, if you are familiar with the sort of concept of body condition scoring, you can sort of check the various parts of their body, so their ribs, their neck, their shoulders, their rump, to keep an eye on whether they are the correct weight, or whether they are putting too much condition on, which is a particular risk at this time of year with April showers and warm sunshine. The grass is now growing very quickly, so we really want to make sure that we are keeping a very close eye on what's going on with your horse. So atypical myopathy is a disease that affects the muscles of horses. It's caused by eating the seeds or seedlings from the sycamore tree, and you can see in the photo on the slide the distinctive leaf shape and seeds of the sycamore tree. The seeds and leaves are obviously dropped in the autumn and winter, and seedlings are found in the spring. The clinical signs it causes are recumbency, whole body trembling, symptoms of colic, and red or brown urine, which is caused by the release of myoglobin into the bloodstream from damaged muscle, and subsequently from the bloodstream into the urine, giving it the distinctive red or brown colour. It is a disease that sadly is fatal for up to 3/4 of affected horses, and again, it's one which you should take very seriously. If you're worried about your horse or pony, then you should ring your vet immediately, and then we can come out and try and instigate the prompt treatment to try and help your horse. This typically involves referral of the horse to a hospital where they can be put on sort of intensive fluid therapy and given the sort of the supportive nursing care that they require. So again, it's worth just having a look around your premises where your horse is kept and identifying whether you have any sycamore trees on site. They are fairly distinctive in appearance. If you are in any doubt, then there are obviously certain apps that you can download that will help you identify plants from their leaves, or again, you can talk to your vet who will help you with any queries on that nature. Tying up is another disease that affects the muscles of your horses or ponies. It's closely akin to the feeling of cramp in people, so imagine it's particularly painful and uncomfortable. It predominantly affects the musculature of the hind limb, so the rump. There's muscles on top of the pelvis, and also the sort of the hamstrings, the muscles running down the backs of the legs on either side of the tail. Horses that are affected will have a sort of a short, stilted, stiff gait at the walk, but will often trot perfectly normally. They may be reluctant to move, the muscles may feel tight or painful when palpated, and the horse may appear to be colicking, which is a sort of a feature of the fact that there's an intense source of pain coming from their back end, so that will appear to give them some of the same symptoms of colic. The horse may also sweat profusely. They may have dark red or brown urine, which again is caused by the release of myoglobin from damaged muscle tissue, which is then cleared from the body into the urine. And the horse may have an increased heart rate, respiratory rate, and increased temperature. Tying up typically comes on when a horse has just finished a piece of work. So as they're sort of walking back to the stables, it can often also affect horses that have been sort of worked hard for the preceding sort of week, and then have had a day off and may be found tied up in the stable. If you're worried about your horse having potentially tied up, then obviously you need to give us a ring as soon as you can. As I say, it can be intensely painful, and we would want to come out and administer some painkillers as soon as possible, and potentially also take a blood sample which can be tested to look at the muscle enzymes of the horses concerned and ascertain whether or not they have tied up. When looking at a horse or pony with a forelimb lameness, we find very often that they have an altered head carriage. This takes the form of the horse's head being raised when the painful foot is in contact with the ground, i.e. is weight bearing, and the raising of the head is the horse's way of trying to reduce the amount of force passing through the painful limb. So the horse raises its head when the painful limb is on the ground, and then when the painful limb is in the air and the weight is being borne on the non-painful forelimb, then the horse will lower its head, and this gives the horse a characteristic head nod, up when the painful limb is on the ground and down when the non-painful limb is in contact with the ground. When we are assessing a hind limb lameness, then obviously we're looking more closely at the pelvis and the horse's back end. If you imagine a vertical line running down through the middle of the horse's backside along the line of its tail, then that will split the horse's backside into two halves. As the horse trots away, you then look at the top of the horse's pelvis, and you see how much movement there is on one side and compare it to the other side. Typically, the horse, if the horse has a painful right hind leg, then there will be more vertical movement on the painful side of the pelvis compared to the non-painful side. So you'll see a greater degree of movement up and down as the horse trots,
on one side than the other, and that's typically the lame side.
We also see horses trotting from the side, and this enables us to assess the stride length of the hind limbs in particular. And the easiest way to do that is to see where the horse places its forelimb and where that comes off the ground, and then make a note of where the hind limb or the hind foot on the same side is placed. And you'll often be able to detect a difference in stride length where one hind foot is placed closer to the hind foot on the forefoot on the same side, versus the lame leg, which will often have a shorter stride length. Let's now talk about wound care. If you've found your horse with a wound on it, then the first thing to do before you investigate that wound too much further is to ensure that you and the horse are both in a safe location. Once you've done that, then you can spend more time investigating the wound itself. And one of the first things it's good to know is the location of the wound, be that on the body or on the head or the distal limb, as this can enable us to ascertain potential seriousness and what other structures may or may not be involved. Linked into this closely is the depth of the wound. So is it superficial, involving only the skin, or is it potentially deeper, involving an underlying structure such as the joint, tendon, ligament, or body cavity? Is the wound bleeding? And if so, is it bleeding a little bit, so dripping out, or is it bleeding more like a running tap? If the latter, then you certainly need to apply pressure to that wound as soon as possible. In the lower limb, this can be achieved by placing a bandage on the wound. You can use lots of layers, lots of pressure. Keep on applying pressure and bandage material until blood stops oozing through the bandage. Don't be tempted to remove the bandage to see if it's stopped bleeding, as this will defeat the object. If the wound is higher up on the body, then you may have to restrict yourself to applying direct pressure with your hands and possibly a piece of bandage material. It may not be possible to fix it onto the horse very easily, but you can still apply pressure and bandage material to it just by holding your hand on the horse on the wound. And obviously, if it is bleeding profusely, then this is important to tell the vet so that we can get to you as soon as possible and try to limit blood loss. If the wound is not bleeding too much, then you can attend to cleaning it. The easiest way to do this is with a cold hose. You just want to run the hose over the wound. You don't want to sort of have your finger over the end of the hose or use a sort of an attachment that gives lots of pressure. This can defeat the object of cleaning it, as it can actually push grit or bacteria deeper into the wound. You really just want the flow of cold water over the wound to help clean it. Also good to know is whether the wound is fresh or old, as this will have an impact on whether or not it can be stitched. Talked a little bit about stitching wounds earlier. Essentially, horses' wounds will repair in one of two ways, either by first intention or second intention. Where possible, we like to try and encourage horses' wounds and injuries to repair by first intention, and this is done by attending to a fresh wound and then being able to adequately prepare it, and then either suture or staple the wound edges back together, and that enables the skin to grow back over the wound relatively quickly, in sort of 10 to 14 days, and then the horse can proceed with its career. In a larger wound, or a wound that can't be closed, fully opposed, you can't fully oppose the skin edges, or in a wound where that is too old to be closed and where the wound edges have contracted and dried up, then those wounds will have to heal by second intention. And this is where the defect in the skin has to be filled in with granulation tissue, and then once that sort of wound has filled in with granulation tissue, then the new skin can grow over the top of it. The downsides to second intention healing are that it can take significantly longer, particularly for a larger wound, to heal, and there is more capacity for scar tissue and sort of cosmetic scarring to occur. So, as I mentioned earlier, horses are adapted to do two things very well, and that is running very fast and eating a lot. Unfortunately, the adaptations required to enable your horse to run very fast also leave it peculiarly vulnerable to injuries of the lower limb, particularly sort of wounds that may affect either the soft tissue structures such as the tendons or ligaments, or the synovial structures such as the joints of the lower limb. So on the left hand side of the screen we can see a diagram that shows us the soft tissue structures in the lower limb. So on the front of the limb, picked out in blue, is the extensor tendon. This is responsible for helping the leg to be pulled forwards as the horse moves. And of greater importance at the back of the limb are the flexor tendons, and these are the structures that pull the leg backwards as the horse moves. So just below the skin you've got the superficial digital flexor tendon marked out in yellow. Beneath that you have the deep digital flexor tendon, which is marked out in pink, and beneath that you have the suspensory ligament, which runs down the leg to the fetlock and then on into the pastern. And this is, all of these structures are literally just below the surface of the skin, and any sort of deep penetrating wounds run the risk of damaging, cutting these structures, and that may result in a long period of recovery, as these sort of flexor tendons and ligaments can take many months to heal. On the right hand side of the screen is a pair of limbs marked with a number of arrows. These arrows are indicating the position of various different joints in the limb. So at the top you have the carpus, or the knee, which is picked out with a green arrow. The knee is particularly vulnerable if your horse trips when out on the road and goes down on its knees. Then those joints can be easily damaged or penetrated by grit or by other debris on the roads. Moving down towards the ground, you've got the fetlock joint marked out with the red arrow. You've got the pastern joint marked out with the yellow arrow. You've got the coffin joint picked out with the blue arrow, and within the foot and vulnerable to penetrating injuries such as nails that go in through the sole of the foot, you have the navicular bursa. Yes, all of these synovial structures are very important to bear in mind if we are investigating a wound or injury near them. A infected joint is potentially career-ending or even fatal for the horse, particularly if left untreated, as it may result in sort of permanent damage, which can result in a sort of a long-term untreatable lameness. So if we see wounds that are close to a synovial structure, we will take special care to discover whether or not that structure is damaged or infected in any way. If a horse has sustained a infected tendon, infected joint, then that horse would typically be referred to a hospital facility where the joint can be flushed out under a general anaesthetic. On the next slide, I have recorded a short video that demonstrates the investigation of your horse's leg, and also the application of a bandage onto a hypothetical wound. You will notice that my bandage technique is not strictly pony club affiliated. I think it's very important to try and bandage as well as you possibly can, but in certain situations, such as when you're trying to bandage a wound to alleviate bleeding or to keep it clean for sort of a short period of time whilst you're waiting for your vet to come and attend it, then we don't need to worry too much about the precise cosmetic appearance of the bandage, as long as it's staying on, doing its job, protecting the leg from further injury and helping to prevent further blood loss.
So one other thing that it's useful to get into the habit of doing when you see your horse either first thing in the morning in its stable or when he's coming from the field is just to run your hand down his legs, sort of front and back, and just feel for any sort of new lumps, bumps, swellings or wounds. This will just get you into the habit of feeling how your horse's leg is normally, and then that will help you to pick up any problems. So in this scenario, we're going to pretend that we've done that and we found that Diamond has got a wound, you know, halfway between his knee and his fetlock on the side of his leg. So there's some structures around there which are you know, important to be aware of. So his cannon bone, his splint bone, his flexor tendons are in the area. So lots of things for your vet to come out and check that he has or hasn't damaged. But in the meantime, your job is to tidy it up and put a bandage on. So we've got some bandage material here, some vet wrap, some lip balm and a soft band. Depending on what the wound is doing, there's different sort of bandage material you can apply to the wound directly. First of all, you could use a poultice. There's nothing wrong with doing that. It does not only for feet. Be aware that poultice has a shiny side and sort of an absorbent side. On a wound, you want to put, and a foot, you want to put the absorbent side onto the leg first. If you're using something that's non-stick, like a melalin dressing, that has a shiny side and a non-shiny side, and you want to put the shiny side onto the wound so it's non-stick, so that's the opposite to a poultice. And the third one you can use if it's a little bit more of a wound that's sort of bleeding and you want to absorb something, would be an absorbent dressing, which again has a sort of a pink side and a foam side, and you would peel off the shiny material from the foam side, and then that would go onto the wound and absorb what's coming out of it. So we'll pretend that he's got a wound that's bleeding, and we want to stop that. So we get everything ready, unwrap our dressings, pick up our foam dressing, peel off the outside cover, we pop that on over the wound, and then we hold it in place with one hand and we put the bandage, the soft band, over the top of that. Sometimes it's helpful to have someone else passing you things if your horse is, well, it's the first time you've done it, so it's always good to practice. I'm sure you're all good at doing stable bandages. Don't worry too much in this sort of scenario about what your bandage looks like, because it's, you know, as long as it stays on, it will do its job. So you've got your soft band on, then you get your stretchy bandage over the top to give it a little bit of compression. That's helpful if it is bleeding, because we can slow the blood flow down, and that will give us a better chance of seeing what's going on when we take it off. Up and down his leg, these are big bandages for his little legs, so go round and round lots of times. Tuck that into a layer below, and then our vet wrap to finish off. The key thing, other thing to remember with bandages is not to put them on, there's a sort of a correct level of tightness. If you're putting a bandage onto a wound that's bleeding a lot, sometimes you just need to put it on really tight, because you know it's only going to be on for a few minutes. If you're bandaging up a wound and your vet's going to come out, less serious wound, and your vet's going to come out and see it later in the day, then you want to make sure that is less tight. And in that scenario, you should always be able to get your finger into the top of the bandage, and that tells you that it's not too tight and it won't damage any of the tendons on the back. So there we go, how to bandage your horse's leg.
So the key thing that I would like you to take home from this talk is not to panic. We may often find ourselves in stressful and upsetting situations that involve our horses or ponies, but hopefully you've got a grounding in common sense and now an understanding of how to assess your horse and an idea of what some of the more serious things are to look out for. But we are very lucky to live in an age where advances in veterinary medicines and techniques and surgeries can permit us to repair a multitude of injuries and treat a multitude of diseases successfully. So even very bleak, upsetting situations are often rectifiable. So ultimately, don't panic, take a deep breath, use your common sense, and get on the phone for some help and advice. Thank you very much for watching this webinar. Some of the topics, as before, are covered on our website in greater detail, particularly lameness examinations and management of tendon and joint injuries. So do please take a look at the website, and yeah, if you've got time, take a look at those webinars. Thank you. Bye-bye. I hope you've enjoyed the talk and have found it informative and useful. Here are just a couple of links that may also be useful. Firstly, to a forelimb lameness video on YouTube, and secondly, to a hind limb lameness video also on YouTube. They're both explain how to assess forelimb lameness and hind limb lameness very clearly with a sort of a good voiceover and some helpful annotations on the screen. So I think they're well worth having a look at. Also, the final link is to our website, and there are numerous other webinars and articles on there if you would like to take a look at them. All right, many thanks. Bye-bye.